Welcome back. We mentioned earlier on that South Africa will begin the second phase of its COVID-19 vaccination program in mid-May. The Health Minister, Dr. Zweli Mkhize, called for those 60 years and above to register on the electronic vaccination data system as of 4 p.m. this afternoon. To talk more about this, Professor Mosa Moshabela is Acting Deputy Vice-Chancellor of Research and Innovation at UKZN. Thank you very much for joining once again, Prof. So, is this according to the original rollout and timeline plan, given the unforeseen delays that we've seen?
Greetings, Sepiso, and to your viewers. I must just first say that, I was very excited to see the launch of the registration for people over 60 this morning. And I just feel like it's something that I would have really liked to have started earlier, but the fact that it's happening a month before the set date of 17 May, where the phase 2 will officially start, I think it gives us a month to basically start preparing. And I really hope that we will use this month adequately. It's not according to the original timelines, but I suppose to be, given the fact that, we had the problem of AstraZeneca, we can accept that based on the Johnson & Johnson timelines, this is the timeline that we were working on. But initially, it was supposed to start at the beginning of April, but we were disappointed by AstraZeneca. So I'm okay. I think I'm happy. Relatively speaking, I'm really comfortable because I think this is going to be really the test. I think vaccinating healthcare workers is relatively a lot easier than vaccinating the general population.
So let's be positive that it means that the elderly will be able to get help should they seek it sooner. But without being alarmist, should the elderly be concerned about blood clots, especially these reports that we're hearing about Johnson & Johnson? Are they more vulnerable given the fact that some may have underlying conditions? Talk to us about that.
Yeah, I think based on the information that we have from the US so far, and this may change, so the people that were found to have clots were, under the age of 49. So they're all the less than 50 years old. So I wouldn't really, and it's unfortunate that they were predominantly female as well. So I wouldn't really, worry about clots in the elderly at this point. And it may have to do with the immune system being able to be triggered a lot more strongly in younger people. So we're still learning. At this point, there's no indication that people who are more than 60 should worry at all.
And we've heard that this is a good opportunity for the private sector to get involved. In fact, I've heard that mining companies have said that even though they've donated money to the fund itself, they are willing to pay for the vaccine so that they can start inoculating not only their workers but people within their community. So this means that we can possibly see vaccination of the elderly go faster in that case. Am I correct?
Yeah, so I think that's the idea. And I think all along when we've been saying that this is not just a government project, it's a whole society project. This is exactly what we are hoping for. Just because I think we know, as you said, that the sooner we vaccinate people, then we can protect people earlier rather than vaccinate them later. And if now we've got all hands on deck in this manner that people are indicating, and of course, it will serve them well because then it means that even the industry and the economy can actually recover a lot earlier. So there is a whole lot of benefits to having all hands on deck on this one. It's going to be the biggest project for the year, and I really hope that it works out, that government is able to coordinate all these different stakeholders.
So there's that thing, a great effort in terms of the Solidarity Fund and the partnership there. But I want to talk about the significance of the launch of the No-Fault Compensation Fund. What is exactly saying here about accountability?
Okay, so I think the first thing that I should say about this service is that I did feel a little bit of pity when the news broke that, these companies were putting government and the minister under pressure to have to push other interests. So I really feel sad. And all along we were aware that they didn't want to take liability. And I think that the way that it's being structured is structured to basically, the starting point is the fact that pharmaceutical companies are not taking liability. But I think it needs to shift. Right now, it sounds like government is also not wanting to take fault. There needs to be something that, a compensation that someone else to take the responsibility. But I think government should own it and then say, look, this is a compensation fund. This is insurance. This, whatever it is that is called, for the people. And it shouldn't really have anything to do with companies. We can accept that companies did not want to take liability, but government will absorb the liability.
Professor Moshabela, I know you'd agree with me that the fine print matters. So in this case,
yes,
how would we then understand what compensation is, and who would then be defined as anyone who may suffer injury as a result of the vaccines? So I know it's too early to ask somebody like you, but what would you think would be satisfactory?
Yeah, I think that the people who do insurance, health insurance, will probably be suited to answer that best. But I would really like it to be different. I would like it to be a lot more inclusive and not have the kind of fine print that we are used to in health insurance. To basically say that even though you might have adverse events that are timed with a vaccine, there can be some sort of compensation depending on the degree to which association can be established. So a good example is the clots, right? So there's been a lot of argument that the clots are actually just background clots that may not have anything to do with the vaccine because the prevalence is similar to what you would find in the general population for the number of people that have been vaccinated. So now, if that is the case, fine print can actually end up saying that, look, the clots have nothing to do with the vaccine. We don't want that. So we really want to make sure that the fund can be a lot more generous than that so that we can protect people. A lot of them would be... The thing about vaccination is that it's not like general health care. You're not treating someone who's sick. You're giving a vaccination to someone who's well to help them, survive and be healthy. So it needs to be a little bit more generous in my view, and I hope that those terms can be negotiated in that spirit.
So the health minister, when he was launching this electronic vaccination data system, saying that every citizen has a right to be fully protected during the inoculation process and that there's sufficient recourse should anyone experience vaccine damages. So there are those two things that we have to balance: the right to be able to be inoculated should you want to, but then the right to have reasonable expectation that you are protected when you get inoculated. But given the fact that there's still a lot of research and development on this, how can government really stand by this? It's a good thing to do, but is it something that they can really guarantee that they will stand by and live by?
Yeah, it's going to be difficult. I think that maybe what they would end up doing, and I think these questions really is things that it's good questions. We need to think about them now when we review this document and comment on it. Because then, it shouldn't necessarily... lack of safety shouldn't necessarily include mild adverse events like just fever or headache. It really needs to include something that can cause a certain degree of incapacity, even if it's temporary. But I do think that you are right. You are absolutely right that when you start to balance those two things, it can create loopholes for what you call the fine print. But I personally wish that it is done in good spirit, whereby we say that anyone who is clinically demonstrated to have experienced a certain illness or disease or adverse event related to the vaccine clinically, as long as it can be clinically acknowledged, then there will be compensation. They don't necessarily have to argue it, go to court or whatever. That for me would suit me better.
Professor Mosa Moshabela, thank you so much for joining us. Acting Deputy Vice-Chancellor of Research and Innovation at UKZN. Thank you so much for your insights as well.